The longest government shutdown in U.S. history. It wasn't really about budget math, was it? It felt more like a ruthless high-stakes game.
Absolutely. A game of political leverage, really,
Yeah.
and American healthcare. That became the ultimate prize.
And for you listening, if you want to grasp how Washington works under, well, maximum pressure, this is the deep dive you need.
That's right. Our sources show this 2025 shutdown, kicking off October 1st, now the longest ever. It wasn't some accidental breakdown.
No.
No, it looks like a calculated political play. And it was driven almost entirely by this fight over expiring Affordable Care Act subsidies.
So our mission today is to unpack that. We're going to break down how Democrats use what was essentially an impending healthcare price hike, a real ticking time bomb, as their weapon.
Their leverage.
Exactly. Leverage to force policy change. And then we'll look at how Republicans pushed back, calling it extortion, loudly.
And they did. And maybe most critically, we need to look at the real costs, the painful costs for millions of federal employees, military families. People got right in the middle.
Okay, so let's get a sense of the scale here. We're talking late 2025, 36 days in. What did that look like on the ground?
Well, the government was basically hemorrhaging productivity. You had around 900,000 federal employees furloughed. Think about that. Nearly 1 million people just sent home. No paycheck.
Wow. And that wasn't even everyone, right? There are people still working.
That's the other part. Another 2 million essential federal workers that had to keep showing up. Think air traffic controllers, border patrol agents, critical security personnel.
But working without pay, or at least no guarantee of pay.
Working without any guarantee of immediate pay. That's the crux of it.
So operationally, what did that mean for agencies?
It was severe. Key agencies faced shutdowns, partial or full. NIH, the CDC, major disruptions there. And really critically, the WIC program nutrition assistance for mothers, young kids, that got hit hard.
Some things kept running, though.
Yeah, central services like TSA, Medicare, they continued. But the sheer scope of the disruption, it made it clear this just wasn't sustainable.
Okay, so let's dig into the actual conflict, because like you said, this wasn't just general disagreement over spending levels. This was targeted. It was about the ACA subsidies.
Exactly. Specifically, the enhanced ACA premium tax credits. Now, these were put in place by a Democratic Congress designed to keep premiums artificially low.
Artificially low. Okay.
And here's the absolute key point you need to understand. These specific subsidies were set to expire. If they did, millions of middle-income Americans using the ACA marketplace, their health insurance premiums could, on average, more than double.
Double. Starting January 1st, that's the time bomb.
That's the time bomb. Democrats knew they had this manufactured crisis point coming, a massive, unavoidable price hike.
And they didn't shy away from using it. We saw quotes, didn't we? Like from House Minority Whip Catherine Clark.
Yes, she was quoted admitting the strategy, pretty much, saying that while shutdowns are awful, this crisis is one of the few leverage times we have. Basically admitting it was a tool.
Wow. So that quote really lays bare the tactic.
It does. Democrats demanded the extension of these subsidies as the, quote, linchpin to fund the government. The strategy was clear. Obstruction. Keep the government closed until this policy demand was met.
And the math on that obstruction is pretty stark. Republicans in the Senate, they kept trying to pass a clean continuing resolution, a clean CR, right? Which would have just funded the government temporarily, kept agencies open, paid federal workers, but without tackling these subsidies right then.
Exactly. A straightforward funding bill to stop the bleeding, and Democrats blocked it.
How many times?
12. 12 separate times they blocked that clean funding bill.
12. So the shutdown just kept going purely as a way to force this one policy change, the ACA subsidy extension.
That's what the source material indicates, purely to enforce that demand on the Republican House and the president.
Okay, and that level of, well, coercion, that explains President Trump's reaction. He was adamant.
Very resistant. He said it publicly, I won't be extorted. He drew a clear line. Reopen the government first, then we can negotiate policy.
And this really gets to the heart of the ideological fight, doesn't it?
It really does. Republican leaders argued the whole reason Democrats had this leverage, this massive looming price hike, was proof the ACA itself is fundamentally flawed.
Their argument being
that the constant need for these kinds of forced subsidies just to make the coverage affordable at all proves the ACA is, in their words, a failed product. It can't stand on its own financially.
Speaker Mike Johnson made that point too, didn't he? Saying Democrats own the healthcare crisis.
Yes, he argued they created the subsidy, they set the expiration date, knowing exactly the kind of political chaos it would create down the line.
So for Republicans, being forced to fund what they see as a structurally broken program, using the threat of huge premium hikes, that was just unacceptable.
Exactly. The sources paint this not just as a budget fight, but as a fundamental ideological clash over the ACA's sustainability. And federal workers, they were the collateral damage.
And that damage wasn't theoretical, it was immediate, devastating for some.
Oh, absolutely. While the politicians argued, federal workers missed full paychecks because of those 12 Democratic blocks on clean funding.
Even though Republicans tried alternatives, like Senator Ron Johnson's bill.
Right, the Shutdown Fairness Act. That was designed specifically to pay essential employees like air traffic controllers, Border Patrol, even during the shutdown. But it didn't get through.
And the impact went beyond just the workers themselves, hitting families hard, military families especially.
That's where we saw some really alarming numbers. Our sources reported one military food pantry out in Kansas saw a 300% increase in traffic.
300%. That's not just a number. That's real hunger, real financial crisis, directly caused by this standoff.
It's stunning. And it seems the Trump administration was left scrambling, trying to manage the fallout from this congressional gridlock.
What could they even do?
Well, they resorted to some pretty extraordinary measures. It shows how desperate the situation was. The Defense Department, for instance, was told to use $8 billion in existing unobligated R&D funds.
R&D funds. To pay salaries.
To try and cover military salaries, yes. A broad directive like that immediately raises legal questions, about executive financial power.
And then there was that private donation, the controversial one.
Ah, yes. The administration accepted a very large $130 million private donation from Timothy Mellon, a longtime political donor.
To help pay the military.
To help cover military pay, that was the stated purpose. Now, you can frame it as sympathetic, but it instantly rang alarm bells. Legal, ethical, especially concerning the Anti-Deficiency Act.
Right, the Anti-Deficiency Act. Break that down for us quickly. What does it prevent?
Basically, it stops federal agencies from spending money Congress hasn't officially appropriated yet. So when a private donor steps in to fund core government operations...
It blurs the lines.
Seriously blurs the lines. It potentially gives outside influence a dangerous foothold in government functions. The administration was pushed into this ethically murky water, just trying to pay people doing essential jobs.
But they weren't just playing defense, were they? The administration also seemed to use the crisis offensively regarding the federal workforce itself.
That's another angle, yes. The Office of Management and Budget, OMB, told agencies to prepare for permanent layoffs, reduction in force, or RIFs, not just temporary furloughs.
Permanent layoffs, that signals something much bigger.
It suggests a longer-term goal, perhaps using this crisis created by Congress as cover to permanently downsize parts of the federal bureaucracy along ideological lines.
And they started doing it.
They did. They began executing these RIFs. At least 4,100 federal workers were laid off, including people at CDC, before a judge stepped in and put a temporary stop to it.
Wow. And this ties into another major power play we saw during this shutdown, this idea of rescissions.
Rescission power, yes, that's absolutely critical to understand here.
So what is it exactly?
Think of it like this. Congress approves funding, writes the check, so to speak. Rescission is the president essentially having the power to say, nope, we're not spending that, and taking the money back, or just refusing to spend it.
Even after Congress approved it.
Even after. It's a unilateral power, president acting alone. And it had been mostly limited, curtailed, really, since the 1970s.
But the Trump administration brought it back.
Big time. Through the Rescissions Act of 2025. And they used it right away to make permanent cuts, foreign aid, public broadcasting, things like that.
Which must have caused huge issues with Congress, especially Democrats.
Immense distrust.
Yeah.
Because if the president can just undo parts of a funding deal after it's made, using rescission, well, what's the point of negotiating in good faith?
Right. It kind of breaks the whole bargaining process.
Completely destabilizes it.
Yeah.
The president can effectively unappropriate funds Congress already approved.
So it's no wonder fiscal experts were calling this. What was the quote?
The most dramatic event ever in constitutional fiscal law. That's how some experts characterized it. It was seen as fundamentally shifting power, giving the president far greater control over congressional spending than we'd seen in generations.
Okay, so let's try and pull this all together for the listener. What's the bottom line from the sources?
Well, the 2025 shutdown, fundamentally, seems to have been a planned political maneuver by Democrats. They used that ticking time bomb of expiring ACA subsidies as their leverage. The goal, force a major policy win on health care.
And Republicans dug in. They fought back hard, framing it as blatant extortion. And importantly, arguing that this whole crisis, the need for this kind of brinkmanship just to keep the ACA funded, actually proved the program itself is unsustainable.
Exactly. And the result of this clash, massive economic disruption, real human pain inflicted on millions of federal workers and their families, all tangled up in political advantage and policy fights.
So the core conflict wasn't just about a budget number. It was deeper. It was about the fundamental health, the structural integrity, maybe, of the Affordable Care Act itself.
That seems to be the heart of it. Which leaves us with a pretty profound question, doesn't it? If a major national program like the ACA requires these constant threats, government shutdowns, missed paychecks, huge premium hikes for consumers, just to keep its funding secure, does that expose a fundamental flaw in the policy itself? Or is this just the brutal new normal of political warfare? That's really something for you, the listener, to think about.